I don't know,
Shut
man.
up.
Something's off with you today.
Get out of here. What's going on, guys? Welcome back to the PT Coffee Cast, brought to you by The Movement. My name is Dalton, and alongside me today is my beautifully bearded friend, William. William, how are we doing today?
I'm doing good. I'm just wondering if I can make a simple observation.
I think you can.
You don't have your socks tucked in
I know. So,
or your pants tucked in.
this is a good point. Now, when it comes to this type of pant, shout out to Lululemon. This is the Lululemon ABC Jogger, as opposed to what I was wearing in the last video, which was the Lululemon Surge Jogger. These are more of my professional fit pants. So I don't tuck my pants into my socks on these ones. What I do, though, is I pull them up a little higher so that you still get the visual on the sock.
That's cool because I did notice your socks, and I was going to ask about them because they look nice.
They are nice. Thank you.
Well, all right. Well, thanks for sharing that with me and, just being open.
No problem. I have a question for you.
All right.
As we record this podcast, it's November 2nd. What's your thoughts on Halloween?
I love it.
I knew you were going to say that.
Yeah, I mean, I love it more now that I have 2 kids.
Yeah.
It's way more fun.
I could see that revitalizing the holidays for me. If you call Halloween a holiday, I guess. But
It's more, to me, it's more of an event.
yeah, I'm indifferent about it. I don't really know how I feel about it.
I never dress up,
Yeah.
but I like the vibes, just to be clear, I would dress up, but I also don't really care to put in the effort. But I'm cool with, like, obviously Rose, my wife, loves dressing up and, like,
Yeah, it's definitely
getting the
her
kids
thing.
decked out. So seeing her, how much she likes it, we like watching scary movies. So it just kind of, like, gets you in, like,
The mood.
yeah.
Okay.
Also, I will say our neighborhood goes all out. I've never seen anything like it. Like, I mean, decked out decorations, kids everywhere. Like, we must have had like 100+ kids come to the door.
That's cool.
Yeah.
Yeah, that makes it better.
I'm getting the sense that you also have an answer to this question.
No, I don't. I just want to ask you. I just want to ask you another follow-up question.
Okay.
Favorite Halloween candy?
That's a really easy answer. You ready? Well, I wonder if you could guess.
I would guess, if I was to guess, I would say Reese's Cups.
You got it.
Yeah.
Cheers to that, man. Look at that.
That's almost 10 years of friendship right there.
Whoa.
Yeah.
Wow.
Yeah. It's also like I'm a big Reese's Cup guy, but I think one that I always get stoked, well, I used to get stoked about getting, I don't really get candy anymore on Halloween, was Coffee Crisp.
Oh.
Yeah.
I mean, that could be the official sponsor of this episode, you know?
But we should get out of this conversation and into like what
Fair
the
enough.
people actually tune in for. But I'm glad we got those questions off our chest. I think this is going to make the episode a little bit better. And if you guys are tuning in, thank you so much. Make sure you guys are subscribed to the podcast so you don't miss out on any of our episodes. You can subscribe on your Apple Podcast, your Spotify, wherever you consume podcasts. If you want to see my beautiful socks and Will's beautiful beard, we have a YouTube channel where we put the YouTube version of this podcast out, so you guys can check us out there if you're into watching podcasts. And then we have the movementmentorship.com, which we're super excited about. We've launched that probably about a month ago now, and it has all things mentorship and podcast. Really excited about it. If you guys are interested in learning more about the mentorship or you want to join our mentorship, you can head over there and schedule a call with me, and I'll take you through all of the stuff that we're going to do in the mentorship and get you into the next cohort. So you guys can sign up there if you're interested in that. But for today's episode, we are going to continue on with our slow drip of clinical questions that we like to ask our clients. If you guys haven't tuned into the series yet, we suggest you go back. We've done 3 questions so far. And the 4th question is a little bit of like fill in the blank, and I'm excited about it. So this week's question is going to be, what would you do if? Is that right?
Yeah.
Is that what
If, quotation, X, quotation.
Right. And that's the fill in the blank. What would you do if? And I think what's cool about this question is you can use it in many different scenarios, and it offers a lot of insight into the client's mind, which I think is, we talk about it all the time. Surprises kill trust, and we talk about trying to set expectations the best we can, and getting inside of someone's mind as much as you can is super helpful in order to, 1, not kill trust, and 2, to set good expectations. And I think this question allows for you to kind of get a sense for where their head's at with stuff.
Yeah, and I think like we talk a lot about like being a guide, right? And like, what does that really mean, right? In order to be a guide, you have to have things to guide. And that's not always like a huge part of that is like guiding them with exercises and things like that. But that's why a lot of our questions are meant to like probe people's mindsets and thought processes, because we can guide those as well.
Yeah, and I mean, I would say it's more important to help guide them on the decision-making process of certain things versus like even like exercise. Like I think obviously exercise is a big part of what we do and how we rehab people and help them get better, but I think at the essence of it is like we're really trying to help people improve their decision-making process of like what's based off what's going on and what their goals are.
Yeah, you're actually helping them learn how to navigate whatever they've got going on with their active lifestyle. You're helping them learn how to navigate that better.
So maybe fill in the blank a couple times for us.
Okay, cool. So one big way I'll use it is, let's say we're doing an exercise and I've kind of demoed it and we've sort of covered why we're doing it and that type of thing. And then, excuse me, I had too much coffee.
Jeez.
Look at that. Or I drank it too fast.
Yeah, bro, chill.
So the next step is to like select a weight, and like often I'll do that for people for a while, but sometimes I'll go, what will you do? What weight will you select? It's not the exact same.
Yeah, but
I get it, right?
I get what you're saying.
Come on, Yeah,
hey, bro, I wasn't giving you a hard time.
Take it easy, right? But, asking them what weight would you select if you were on your own?
Yeah.
And I love that question because it gives you a sense of like, one, are they gonna like way overshoot, right? Or, are they being super conservative? Like, are you giving them a deadlift and they're a 220-pound male and they're picking the 10-pound dumbbell?
Right.
Right? Like it gives you a lens into like what they're thinking, and then maybe you can see what they do with that if you think it's safe, and then probe a little bit more into like why they chose that weight and that type of thing. And that can, in my mind, give you so many interesting conversations.
Yeah, for sure. I mean, like if you even kind of just play off that, right? It's like when you ask them like, well, what made them choose that weight, that 10-pound weight, they could talk a lot about like, well, in the past, like I've hurt my back doing this, or I'm worried about it. So it gives you a sense for like, okay, they're still nervous about loading more. Or it could be like, honestly, I have no idea why I picked that weight. I just thought that it made sense. And then that obviously gives you an idea of like, okay, well, maybe there needs to be some education around like loading and how to make the decision of what weight to use and how much weight they should be progressing to and that kind of stuff.
Exactly. Like you can teach them about like building up to a top set, different things like that. Mm-hmm. And so it's such a great question because like it can go so many different directions.
Yeah.
Or it could give you a lens into like, oh, their confidence is increasing.
Right. Yeah.
Right? If they, at the start, maybe they would have never chose the 40-pound dumbbell, mm-hmm. but you ask them and they're like, I'm going for it.
Yeah.
Like you're getting a lens into like where they're at.
Yeah.
So many different, just one question, lots of different possibilities.
Yeah, one that's kind of come to my mind, it would be like, what would you do if you didn't have, what would you be doing if you didn't have this pain limiting you right now?
Oh, that's a huge one.
Yeah.
Yeah. So talk a little bit more about that.
Yeah, because I think it, like I'll often ask that question like sometimes early on in our time together, like even on our initial assessment sometimes, because like I find like a lot of times obviously people are seeing us because they're in pain, but they're seeing us because they're not doing something that's meaningful to them or that gives them a sense of self. And so a lot of times people are like taking those things away from themselves. So by asking that question, they immediately gives you a good idea of what that person wants to be doing, right? And so like for example, and what's cool about it is like for example, like you could ask that question, they'd be like, well, I just want to go for a walk with my dog. Or and they could even be more specific, like I want to be able to walk my dog for 5 kilometers like I used to do every day. And now it's like, okay, cool. How do I figure out how to immediately implement that into their program and start showing them that they can do this even though they do have pain? It might not be walking your dog for 5 kilometers, but we can literally start walking your dog most likely tomorrow. And here's how we can go about doing this. And so it immediately starts like, oftentimes people are taking way more away from themselves than they think, and they don't think about how I can break this down into like an easier way to accomplish it. And I find as a clinician, like you can get a ton of good buy-in with a client if you immediately have them doing something or some form of what they want to be doing as soon as possible, because they'll, one, be fired up that they're doing it, two, it shows them that you have a plan towards how you're going to get them there, and three, a lot of times people, healthcare professionals take away things from people, and when you give them back to people, it automatically, I feel like, helps your buy-in, your connection. People want to work with you because you're like, oh no, we're going to figure out what we can do immediately to get you doing what you want to do, instead of being like, no, you can't walk your dog for the next year.
Yeah, just like one of those questions where like it really is useful. I think it can help you with like figuring out how to guide that person. But I'm wondering, so ask me the question. I'm curious if you ever get this.
Oh boy. Are we doing some role playing?
Yeah.
Oh no. Okay. So, Will, what would you be doing right now if you had no pain in your knee?
I would just feel better. I would just be happier.
Okay. What would you be feeling better and happier about?
That's a good question. I don't know.
Well,
We can end the scene.
Okay.
I didn't want to put too much pressure on you.
Oh, dude, I was ready, man. I've been like.
Were you?
I did an improv class once.
Like where? What? Like
I think I would have said, well, what makes what? Because what did you say again? You said what? I want to just feel good and be happy.
Yeah.
I'd be like, well, what makes you feel good and be happy?
Yeah.
Because there's always something.
Yeah.
Right. Like I get what you're getting at is where people have nothing, you know. But like, there's always something.
And I think like also they maybe haven't thought about it.
Yeah.
They're just so focused on the elimination of their pain.
Yeah.
That door hasn't even been opened.
Yeah, and honestly, like, I tend to bias more towards this. It's just my personality. I'm very curious, and I want to try to like really understand where people are coming from and why people think the way they think. I just love that in general.
Yeah.
And so I bring that a lot into like my practice, but like I would pull on that thread for a while until like we could like maybe come to a decision together of like what there's something there. There has to be something there. It's like, well, what is it? Like maybe they haven't thought about it, and maybe they'll start being like, well, why does this matter? Or like, and we'll have that conversation, and maybe we'll get to something specific. But even if we don't, I take it like a little bit farther.
It's like planting the seed.
Totally. So that like when we're going through the session, and then something comes out, and they're like, well, like my new puppy that I had, I got to take him out to go to the bathroom. And I'm like, oh, that's awesome. Like, you got a new puppy? It's like, that seems like something you might want to be able to do with a dog, right? Like, is that something that makes you feel good or makes you happy? Right. Well, yeah, it does. And be like, cool. Well, let's get you getting that dog out and taking him for a pee, you know? Like, there's always, like, something. There's always something, right?
I really like that example.
Yeah.
But, yeah, no, for sure. Yeah, and, like, I like the idea of, like, planting the seed, too. And sometimes, like, it's, like, that door just kind of, you're just, like,
yeah,
like, nudging it open a little so that, like, maybe as the session's going, they're, like, starting to feel a little bit better. And they're like, I've actually been, you know what I like? Like, I used to run. I haven't thought about running. Like, that would be cool if I could run. I wonder if I could do it now, you know? And so you're just, like, slowly, you know what I mean?
Totally. Yeah. And I mean, like, we're kind of going off on a little journey here, but I think it's important because, like, I think that stuff is so important. Like, I really do believe that is one of the most important things to do, is to go to those places with your clients. And I think as a profession, as physios, we sit in such a good spot to have the opportunity to do that, and we don't utilize it enough, I don't think. And, like, even if you have shorter sessions, like, I know we're a little bit luckier here because we have hour-long sessions, so we can spend a little bit more time doing that. But even if you don't, it's like, that is so worth it. And it's so worth taking 15 minutes to sit there and have that conversation with that client and go there. And I think as a profession, we need to see the value in that and make sure that is also seen or, like, portrayed to the consumer, because no one gets time with a healthcare professional like they do with a physio, you know, like, especially when it comes to injury and when it comes to, like, musculoskeletal type injuries. Like, you're not getting that time with a doctor. How many times have you had people come in here where they're like, you're the first person who's ever asked me this question or taken any time to? That is a value that is so important, and I think we need to go there. And we know how much getting information out of that is valuable to the clients and outcome, as well as just important to them as an individual, that you gave them an opportunity or that you nudged them a little bit when they're just like, well, I just want to feel good. It's like,
yeah.
Okay, cool. Like, I believe that, but, like, what does that mean? And, like, let's really go there. Like, let's figure this out.
Exactly. And there's something you could be doing if you're mobilizing a joint or doing a test or
totally
between sets or whatever it is. Like, just to ask a question like that, you know, can really bring you to some places where there's real opportunity for massive transformations. And just why we all do this, right?
Totally.
Yeah.
And then, like, it makes that interaction more meaningful. It makes the outcome more meaningful for the client. It sometimes it comes easy and sometimes it doesn't come easy. And you're going to get people that maybe that's not happening right away, or they're going to play it off like, I don't want to go there, blah, 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 which, like, that's cool. Like, you have to navigate in each individual as they come. But when I think back to, like, most clients that I've had that have had successful outcomes, whether their personality is, like, super open and they're, like, down to share, or whether they're a little bit more reserved and, like, not sharing things, like, eventually it comes around and you have that conversation with them. Like, it gets there. It takes time, but even with the people that are, like, so reserved of, like, sharing with me, like, eventually we get there.
And sometimes you just got to do a little pump fake to see if they're going to bite.
Yeah.
You know what I mean?
Yeah.
Like, a little, like, you can pull back on the question a little bit if it's not, like, you know what I mean? If they're, like, very resistant.
Yeah, you just probe it a little bit.
They're not biting on the pump fake.
Yeah.
Then it's like, hey, no worries, let's do the next set. Or here's the weight for you.
Yeah.
You know, it's, like, not a big deal. You just brush past it. But, like, if you get any inkling that they're going to bite on that pump fake, right, then you're going to drive it right to the hoop.
Slam it down.
I was, like, not sure.
I was like, where's this going to go?
Really?
You finished it off.
Yeah.
Yeah, cool. I know we went off a little bit there, but is there anything else around that, like, question, like, what would you do if, insert this here, that you want to touch on before we wrap up?
Yeah, totally. I think we'll do one more, like, clear example, but I think the cool thing about this question is you can literally do it for anything. But a big way that I use it is for like getting a sense of their decision making between sessions. So like I would say, what would you do if this exercise started getting easier between the sessions? And so what I want to see is, are they going to make a decision to make it harder in some way?
Yep.
Right? Because I don't want, if I'm extending their time out between the sessions, I don't want that to be, just status quo the whole time, or I might as well see you next week, right? Like I want them to actually make decisions to try to push things a little bit more between the sessions.
Yeah, and I think another similar one is like what would you do if your pain flared up?
Right. If it was increasing, with an exercise, and then that gives you the opportunity to provide some advice there to overcome that.
Mm-hmm. So I think those are like two really good ones that
Yeah.
clearly give you a lot of information about the client, where their head's at, what they're going to do. And it just gives you another opportunity to like educate, right? And it's coming from a place of like, they're giving you some thoughts and then you're working with them on those thoughts versus like you could easily be like, hey, so if you want to progress this exercise, here's what you're going to do in between the time that I see you from now until when I see you next. Or same with pain. It's like, if you have an increase in pain, like here's what you need to do. That's one way. Or doing it the other way is like, it's them offering their thoughts and you refining their thoughts, which I think is a better way to like have it ingrained in their mind.
And you can do it like a little bit like, let's throw an example out there. Someone has knee pain. You've showed them a strategy to use a hip dominant pattern going upstairs. They're going on a trip, right? What would you do? So you explain how to do that first. Then you go through the rest of your session. End of the session, what do you do if you come up to a bunch of stairs while you're on your trip to Venice, right?
Mm-hmm.
You have them work through it already having been told that, and then you make some refinements where necessary.
Totally.
Right?
Yeah.
So it's like they're going through a learning process, but you need to make sure that they actually learn it,
Yeah, it's a good way to like check on that. And it's funny because sometimes you get some pretty wild stuff.
Totally,
like,
right?
I was laughing in my head because all I think of is like someone being like, yeah, like I would just get down on my hands and knees and just like bear crawl up the stairs.
Well, that's just what you would do,
and then,
even without having pain.
I know, and then you'd be like, oh, okay.
Yeah. No, I mean, I've had people not like mistake a knee exercise for a foot exercise, or right, like vice versa, and like just having that quick clarification could potentially prevent that.
Yeah. No, for sure. Sweet. I think that's great. I think
Cool.
those are good examples. It's a good question, man. It's very very dynamic.
Yeah. It's like the the LeBron James of questions.
Dude, this guy's on a basketball kick,
Right? Versatile.
This guy's been using Chat GPT too much. He probably typed in before here like what
I'm wearing my Jordans.
like what basketball analogies can I use?
Yeah, that's because I'm really just thinking about getting back on the court, right?
Dude, throw it back to the PT school days when we used to do some runs.
Oh yeah. Yep. We're better at podcasting.
Which tells you a lot. But yeah, thanks for tuning in, guys. We really appreciate it. If you aren't subscribed to the podcast, make sure you head over to your podcast platform, Apple Podcasts, Spotify, wherever you're listening. Subscribe so you don't miss out on any episodes. If you want to see Will in his J's crushing podcasts and basketball analogies, you can head over to YouTube, subscribe there. We have the full podcast episode that goes out on the YouTube. And then themovementmentorship.com has all things mentorship, all things podcast. If you're interested in the mentorship, you can schedule a call with me to talk about the mentorship, see if it's a good fit for you, and get you into our next cohort. But yeah, that's all we got for today, guys. As always, stay caffeinated. Peace.